prices, so don't throw stones, okay? But I do hear all about them, so I can empathize, and I'm sure some of you can teach me some things, a thing or two about access and the trials and tribulations with getting some of these medications. So for those of you who have been on any of these therapies or know about them, you know that they're not as simple as the doctor writes the prescription and you can go to your local CVS 15 minutes after your appointment, right? And so that's because these medications fall under this bucket called specialty medications. So we all know they're special because they're expensive, but they also do wonderful things which you guys have heard about today. So why are they treated in this special bucket? Why does it need a different pharmacy? Why are there all these insurance hoops to go through? And then sometimes when you go through those, why are they still hard to access? And the reason why they bucket it this way is a lot of the times, unfortunately related to the cost with them, but also the complex when patients are on these medicines from a side effect standpoint and drug interaction burden. This class of specialty medications came into existence because insurance needs to make sure it's the right drug for the right indication and that we have the data to support it, which you guys have heard about today, and there's always upcoming new data and changing data, so that we're prescribing it for an indication, that there's a way and a monitoring plan for it, and ultimately, is there someone who's going to follow it? So be it that specialty pharmacy that's filling it, your doctor's office, the manufacturer's company, things like that. Cancer medications are not the only ones that go through specialty pharmacy. Other chronic, serious medical conditions also have their medicines go through these specialty pharmacies. So things like MS and cystic fibrosis, HIV and AIDS, hepatitis C drugs, things like that. With regards to access and cost for it. So you get it approved through the insurance a lot of the times, but then you get the phone call from whatever pharmacy is filling it, okay, the copay is going to be some crazy number, right? And with regards to that, it really depends on the time of the year. So for any prescription, if you're filling something newly in January, a lot of insurance companies have those deductibles you have to meet. So a lot of times, even just understanding where you are in the time of the year, and understanding what your insurance plan offers, what your deductible is. So saying, what is my copay this month versus is that what it's going to be every month? Is a completely fair question to ask whenever you're given a price for any prescription, not just specialty medicine type prescriptions. With regards to what different types of specialty pharmacies exist, sometimes your insurance companies force you to go through one. So if you're at an institution that may have their own specialty pharmacy, so for example at HUP, we have our own. So selfishly, I would love if my patients could always fill through us, because then I know the medicine's been filled, it's coming, we know all, there's no things to worry about. But sometimes insurance companies have pharmacies they prefer. So if there's that kind of disconnect that if you see your doctor and then your doctor's like, you can pick it up from our pharmacy or it will be delivered from our pharmacy, but sometimes the insurance has other plans. So kind of understanding there are things out of our control at times. With that being said, kind of specialty pharmacies that exist can be from your institution, but also are some of the bigger name ones that are out there like Accredo, Biologics, Priova. Seeing some nods of recognition for having filled through those pharmacies. And so they're the ones that will usually have a pharmacist reach out to you or a nurse on that team to kind of make sure you understand how to take the medicine and review your medications again, just as that another layer of clinical support, which is why it goes through a specialty pharmacy and not your corner pharmacy. With that being said, a lot of these major retail chains like CVS and Walgreens specifically have partnered with some of their local stores that if you would rather get it shipped to that store and pick it up there, if you have a relationship with those pharmacists there or just want the ability to pick it up and not wait for it, that has kind of happened in the last few years as well. So for those of you who have had that experience. I think, like I said, not throwing stones at the cost, we know some of these medicines are expensive. So despite them being approved, how are we going to pay for it and what's available? So if you have commercial insurance, so if you're not of Medicare eligible age, a lot of manufacturing companies actually have really robust copay assistance programs where medications can be had for a monthly copay of anywhere from $0 to $10 per month for up to an annual benefit of anywhere from $15,000 to $25,000, which definitely helps. Those programs are oftentimes just for a year, so then, if you're on the medicine for a longer time, understanding do I need to reapply or kind of have things changed. With that being said, 4 of the 7 major drug companies or manufacturers who make these targeted therapies that you guys have heard about today actually have programs that advance the supply of a medication. So if you're kind of doing that insurance, copay, hoop jumping through, they all have fun names for them like Sure Start or Rapid Start, but they can actually advance anywhere from a 5-day to a month supply of the medication, depending on the manufacturer. So again, if you're kind of in the woods and upset that you're not able to start on a targeted therapy that you are supposed to be on, if you don't have the resources at your the institution you're being treated at, even as simply going on that drug manufacturer's website, there's a patient resources tab that you can look for that has a lot of the stuff that I'm mentioning today. In the situation that you are a patient not with commercial insurance, or say you don't have any insurance or you have Medicare, a lot of the times the drug companies, you can't double dip. So if you're already on Medicare, which is supposed to make things more affordable, which we know that doesn't always translate within the cancer world when you're treating and having these copays, they can't give you the copay card. So you can't get that benefit we talked about sooner. But 6 of the 7 major manufacturers actually have patients' assistance foundations specific to their own manufacturing pharmaceutical company that can help provide free drug at no cost. And so I think this is an important thing. While, again, navigating this can be difficult, partnering and understanding if that drug company can offer you an advanced supply while you kind of figure out the logistics of do you meet the requirements to get free drug through that manufacturing company. We have... so the one that didn't have a program was Gelatrif or Afatinib. That was not, at least not broadly advertised on their website. So that doesn't mean it doesn't exist. It just took way harder to dig through it, and I don't have personal experience with going through the manufacturer to get it, while the other ones are if you don't have insurance, let us help you, type of thing. They make it a little bit more transparent, but in the digging that I did and the phone calls I had made kind of in preparation for today, that was the one that it seemed like a little more hoops to jump through to get something for free versus the other ones are a little bit more transparent. With regards to any kind of the grants or things that are approved, they're often for a year time. So again, just keeping that in the back of your mind, kind of whenever you're approved for a prior authorization for a drug or any kind of grant or financial assistance, understanding, well, when does this run out so that we can be proactive about getting the ball rolling before, or if I ever need something.
What's the renewal rate on those grants? For folks?
So the question was the renewal rate. So through the drug manufacturers, for the most part, the commercial ones are usually 100%. Where we run into issues sometimes is with the completely free drugs. If you were a patient with Medicare or you had no insurance, kind of being reassessed. Again, it really depends on what the financial status or what your income is. So if you win the lottery, I think they're going to have a hard time giving you free drug, so to speak, after if your finances change dramatically. So if we go and kind of the other route that I did want to mention, which is what if we don't want to go through or we can't go through the drug company? And so there are a lot of just grants out there that are outside of drug manufacturers to help cancer patients afford therapy, not just oral therapies, but offsetting costs of IV therapies, offsetting costs of travel, and other things related to just being a patient who has cancer or taking care of a patient who has cancer. And those foundations too, the thing that's tricky about them is the money kind of comes and it goes based on donations and what things are there. And so a lot of the times these specialty pharmacies, ours included, will check these different grant foundations to see, is there money available for, just patients on oral chemo, patients with lung cancer, patients with EGFR cancer, people and foundations donate to specific causes. So you can be a self-advocate and be aware of these groups and, kind of keep an eye out for things like that. A lot of the times, if you've already paid a copay and you get a grant, some of this stuff can be retroactively given back, so you can get some money back or can be back billed to that pharmacy. So if you were making on a payment plan with a pharmacy for an expensive copay to kind of offset things. Some of the big ones and the ones that we routinely use over at HUP, where we work and to offer patients and we kind of routinely keep an eye on is the Patients Assistance Network Foundation, or PANF if you've heard of it, Patient Advocate Foundation, Patient Services, HealthWell, Cancer Care, Good Days, which was previously known as the Chronic Disease Fund, the Assistance Fund, and the National Organization for Rare Disorders. So sometimes, with these new kind of fusion panels and things like that, that's where you could find assistance or grant coverage for a medicine that may not necessarily be on label yet, where we've had some luck with some of our patients. And I think at the end of the day, getting back and partnering with your doctors and saying if something is too expensive, or your healthcare team or social work or whatever resources you have, those different stakeholders on your care team, to say, I can't afford this, and or I want to be on this, and what options do we have? Because the information is out there, and there's people like me who know this and would be more than happy to help everybody access this kind of information. So I know, and I'll be around if there's questions that are specific to it, but I don't know if anyone wanted to share or add anything or have me touch upon anything else.
There was a question that came in online, which is basically, there's a question about, is it the case that under Medicare, you're now not allowed to use coupons or discounts due to a new law?
It's not necessarily a new law, it's just a lot of the times the drug manufacturer doesn't necessarily let people double dip with getting the zero copay card, which is not a new law, but they have other programs available for Medicare patients, but they aren't always like, here, have the drug with no cost, or for such a high, here's zero copay for up to an annual amount of $25,000. But they have other programs. So a lot of the times you're not told, no, we can't give you assistance. It's almost just a different bucket, and sometimes there's different requirements versus someone with a commercial insurance plan, where it really isn't as much, other than you having commercial insurance and oftentimes being a citizen of the United States. That's all you need for something like that, versus a little more boxes to check.
Great.
Thank you.
Thank you so much.